All right, everyone. I think it's about time to get started if you all want to get home at the end of the day. So good afternoon. Thank you for staying late with us this afternoon. I'm Jonathan Dyal. I'm an assistant professor of emergency medicine with the University of Texas, Houston. And today, I'm pleased to share with you the top global emergency medicine articles of 2022 on behalf of the Global Emergency Medicine Literature Review. I have no disclosures to report, and before we get into the top articles, I'd like to give you some background as to how they were selected. The Global Emergency Medicine Literature Review is in its 17th year of publication in academic emergency medicine. As a part of the review, our mission is to highlight and disseminate high-quality global emergency medicine research, illustrate best practices, stimulate additional research, and promote the further professionalization of global emergency medicine. Although we are not a systematic review or a meta-analysis, we do have a rigorous structure and a standardized approach. The initial review begins in PubMed with a keyword search in several languages that highlight important themes in global emergency medicine. As shown here, the search emphasizes both emergency terms and global health terms to cast a wide net in our search for the best articles. The search is performed twice a year, initially in August and then subsequently in December, to capture all of the best articles possible in that time frame. A separate hand search of other key journals is also performed to make sure that all appropriate articles are included from these high-yield sources. Once the initial search is performed, the tens of thousands of articles that are collected are then screened for their relevance to global emergency medicine. Specifically, all articles that are selected at this stage must fall into one of the three categories listed above, either emergency care in resource-limited settings, disaster and humanitarian response, or emergency medicine development. They're then identified and categorized as either original research or review, and as either quantitative or qualitative research. After screening, the hundreds of articles still remaining are then scored and evaluated using standardized rubrics that consider their clarity, study design, their ethics, their importance to the field of global emergency medicine, their likely impact on global emergency medicine practice. The top scoring articles are then given a full review and summarized by members of the Global EM Literature Review team. In addition to the main review, a separate search is made through the gray literature, meaning articles published through less formal communications, including news bulletins, practice guidelines, and other media. We specifically search the websites of the organizations above to make sure that these high-yield organizations are well represented in the search. As you can imagine, this is an enormous and coordinated effort requiring steadfast and dedicated commitment from the nearly 50 review members described above. So with tremendous thanks to all of the GEMLR team, let's dive into the top articles from 2022. This year's search yielded almost 60,000 articles, of which 527 were selected for scoring, and the top 33 articles were then individually summarized and reviewed. For this year, the top scoring original quantitative research article comes from Elbai et al. In the Chinese Journal of Traumatology and is entitled Assessment of Patients' Outcomes After Implementation of the South African Triage Scale in an Emergency Department in Egypt. By way of background, as we all know, ED overcrowding is a global problem and some countries have identified it as a national crisis. Among other interventions, various triage methods have been employed to combat ED overcrowding. Developed in 2004, the South African Triage Scale is one of several ED sorting systems that have been applied to address this need. The objective of this study was the evaluation of the effectiveness of SATS to reduce patient length of stay and mortality rate at the Suez Canal University Hospital Emergency Department in Egypt. The study was conducted in 3 phases. First, a pre-intervention phase, where 115 patients were assessed by the traditional protocols. Then a second intervention phase, where a structured intervention program was implemented to train ED staff. And third, a post-intervention phase, where 230 patients were assessed by SATS. All patients were then re-triaged after 2 hours, the length of stay per patient, and mortality were assessed. As demonstrated in their Table 2, after implementation of SATS, there were significant improvements in the basic clinical assessment of presenting patients and improved evaluation for early warning signs for poor clinical outcome. Table 6, on top, also shows significant changes in the disposition of emergency department patients after SATS implementation, indicating reduced rates of over or under triaging. Most importantly, Table 8 demonstrates a significant mortality benefit after implementation, with a 2-fold greater odds of survival after the implementation of the SATS method. Further results demonstrate a dramatic reduction in the length of stay in the emergency department, from 180 minutes before the intervention to 50 minutes after the application of SATS. Prior to the implementation of the method, 15% of the patients died before. This then decreased to less than 11% of patients after the intervention, correlating with the 2-fold improvement in patient mortality. The authors conclude that the SATS improved the initial assessment of patients presenting to the emergency department, resulting in decreased length of time and a reduction in mortality rate compared to their traditional protocols. Our next article is the top scoring article of original qualitative research and comes from Green et al. In BMC Public Health. It is titled, "Most of the cases are very similar, documenting and corroborating conflict-related sexual violence among Rohingya refugees." For background, in August of 2017, a large population of Rohingya from Rakhine State in northern Myanmar fled to Bangladesh due to Myanmar security forces' clearance operations. This study then sought to document the patterns of injuries and the conditions experienced by the Rohingya, with a specific focus on sexual violence. Qualitative interviews were conducted with 26 healthcare professionals caring for refugees in this setting. A semi-structured interview guide was used to capture respondents' background and their work experience with this population. Key topics included their professional background and the context of their work with the Rohingya, their experiences treating these patients and injuries observed due to physical violence, their experiences treating patients in relation to sexual and gender-based violence, the mental health status they observed in their patients, factors associated with the disclosure of sexual and gender-based violence, and challenges in providing healthcare and addressing trauma. Some representative quotes from this work are shown here. A nurse midwife commented that most of the cases are very similar. Families killed in front of them and then raped. Survivors escaped in the bush across the border. A clinical psychologist also commented, "We found that most of the refugees were suffering from PTSD. They didn't feel comfortable in talking with us. It was like having come through this crisis, many of them seemed to be totally blank. No emotion was working in their mind. They cried continuously, and upon being asked anything, the first answers they gave were about what they had seen there, how they had come here. They described the difficulties of the situation and how much they had to walk, so many deaths, then rapes and other fears, and that they were scared." From thematic analysis, the author's conclusions emphasize the importance of offering universal and comprehensive trauma-informed services to all refugees in this setting. They support mandatory survivor-centered and trauma-informed care training for all healthcare workers in such settings. They also encourage the provision of long-term, consistent screening with clear referral pathways and critical mental health services. And they emphasize the need for justice and accountability for the violations by the perpetrators. Our next article was the top-scoring review paper of 2022 and comes from Gan et al. In the Frontiers in Pediatrics and was titled Contemporary Trends in Global Mortality of Sepsis Among Young Infants Less Than 90 Days, a Systematic Review and Meta-Analysis. Our current knowledge of the global burden of infant sepsis is limited to mostly population-level data. Their objective, then, was to summarize global case fatality rates of young infants with sepsis stratified by gross national income and patient-level risk factors. The authors performed a systematic review and meta-analysis on case fatality rates among infants less than 90 days old with sepsis. They searched a variety of databases for articles from January 2010 to September of 2019 and collected over 6,000 papers from nearly 250 different studies. Overall, they found a pooled case fatality rate for infants with sepsis that was 18%. This was highest for low-income countries with a case fatality rate of 25%, followed by low and middle-income countries, which were almost 25%, and this was lowest for high-income countries, where the mortality rate was only 12%. The univariable regression demonstrated potentially higher case fatality rates for low birth weight infants, those born outside of high-income countries, those younger than 28 days, and those with culture-proven sepsis. On multivariable analysis, gross national income had the greatest impact on case fatality rates. Figure 5 from this important article demonstrates a time trend analysis of the case fatality rates in this study. Here, the size of the bubble is proportionate to the number of infants in the study, while the line represents the trends in case fatality rate over time. As you can see, there is an increasing trend in case fatality rate for low-income countries and a decreasing trend for middle and high-income countries. Overall, we see that the trend for young infant sepsis case fatality rates is increasing over time. To summarize, the review showed an overall case fatality rate of young infant sepsis of 18% with increasing disparity between low and middle income countries compared to high income countries. The factors they associated with higher case fatality rates were prematurity, low birth weight, age less than 28 days, early onset sepsis, hospital-acquired infections, and sepsis in middle and low-income countries. These findings serve as a global call to action to achieve further reductions in young infant sepsis mortality. The authors note that future initiatives could focus on improving the delivery of care to infants at higher risk of sepsis, especially in these low and middle income countries. Our final article for this year comes from the Gray Literature Review. This year, among the more than 7,500 articles that were screened, 35 were selected for scoring, and only one article received a perfect score. The top scoring article from the Gray Literature Review was by Julien Potet et al., titled Snakebite Envenoming at MSF, a Decade of Clinical Challenges and Antivenom Access Issues. Briefly, MSF provides medical care in more than 70 countries and admits more than 7,000 cases of snakebite every year to their facilities. This article describes the activities against snakebites in 3 African countries, including the Central African Republic, South Sudan, and Ethiopia. Specifically, MSF has introduced a standard protocol using 2 different antivenoms depending on the patient's clinical syndrome, and a simple blood coagulation test performed to detect venom-induced coagulopathy. They have also implemented community-based activities that focus on preventative measures and emphasize prompt transport to the hospital. The authors conclude that provision of quality care and treatment, including antivenoms, without out-of-pocket payment by patients, has led to an increasing number of snakebite victims receiving appropriate care at MSF facilities. So on behalf of all of the contributors to the Global Emergency Medicine Literature Review, thank you for your attention. If you or someone you know might be interested in contributing to the review in the future, please consider applying to join our team with the next review this summer. Thank you so much. And I'm happy to take any questions. If there are any, you can come to the microphone in the middle. And it's also late this afternoon, so we can head home too. Thank you, everyone.